problems facing our country today are jobs and healthcare. That's why we're excited to introduce you to the MedMatch opportunity. MedMatch is a web-based platform planning to revolutionize the home healthcare industry. Currently, over 12 million people receive care in their home. This number is rapidly increasing as the baby boomer population ages and rising healthcare costs are forcing patients to check out of hospital sooner. MedMatch plans to match trained professionals with home healthcare patients when and where they need them. MedMatch will reduce the short-term staffing costs and provide access to more quality trained professionals at home. The home healthcare market is currently 27 billion and increasing at 20% a year. Out-of-pocket private payer accounts for $5.5 billion of the home healthcare market. Over 1 million home healthcare professionals are employed, and this number has grown 5% since 1993 annually. A severe geographic challenge also exists in this sector of the market, as professionals traveled just last year close to 5 billion miles. Believe it or not, that's more than double UPS globally.
So how do people find home health care professionals today? They post an ad on Craigslist, they get a referral from a family or friend, or they call a traditional staffing agency. These traditional staffing agencies charge high prices. The difference of MedMatch will have the professionals will have a profile, screen profile, security checks, everything that's mandated in the healthcare industry. We'll have a rating system, and we'll sort of be like an eHarmony and an open table kind of mixed together, where we'll take the patient's needs and we'll route that with an algorithm to geographically located professionals that can serve those needs in these specific territories. So, and then as far as making money, we'll charge a percentage of the hourly fee on both sides, charge a percentage to the poster, and we'll charge a percentage to the percentage of the hourly rate getting paid to the provider. So what we're looking for is a developer and an advisory board to help us build out the solution.
So why did you decide to approach this problem?
Sure.
So it was actually speaking to nurses that actually work in per diem shifts, that work in hospitals. So we did about a survey of about 300 nurses and healthcare professionals. 75% of them said they work 1 to 5 shifts a month per diem for like an outside agency, and they also said that they would work more if it was geographically located closer to their homes.
Same comment as I made previously. If you'd have pitched that information rather than the top down that you'd have done, this would have been a much more believable case. Because you're pitching this right from the top, and you don't appear to have much knowledge of the detail of the industry. So
I actually think if you talk to anybody that's tried to find home health care for a loved one, you'll find that they typically go to their church or family and friend network. There's not currently something aside from Craigslist, which is not as reliable. There's not a source currently.
Right.
This is an industry where there's just tremendous regulation and regulatory risk. And when you intermediate between a healthcare provider and a consumer, I would imagine that you just have a tremendous amount of being litigated if there's something going wrong. How do you propose to manage that litigation regulatory risk?
So we're actually not going at, we're going after the private payer market, the out-of-pocket, looking for trained healthcare professionals, certified healthcare professionals. We're not billing Medicare and Medicaid, so there's a lot of regulations that don't apply in this space. But insurance, I mean, there'll be liability insurance for all of the professionals that go on the site, and I mean, that's really the only way you can mitigate that risk is by buying a liability policy for that type of an incident that may happen.
Do such liability policies exist? Have you looked into that?
Yeah, so, I mean, home healthcare agencies today have, liability insurance. We actually spoke to a lot of home healthcare agencies, and another kind of aspect of this business is to serve. So the Visiting Nurses Association did a survey of home healthcare agencies, and they're at a 10% staffing deficiency. We talked to about 75 agencies, and they said they turn business away weekly because they don't have the resources. So another aspect of this platform would be basically building this database of all the professionals, and then utilizing it not only for like a retail aspect, someone's paying out of pocket, almost like a wholesale aspect as well, where you could serve as additional resources not only locally but geographically in different geographic areas for an existing home healthcare agency. They say they're about 10% deficient in staffing almost at all times.
What will you do, or how do you divide your responsibilities if you do this?
This is actually where we're just finishing our MBA at Babson, so this is our capstone project.
If you do it, what will you?
We also have 4 other team members, so we haven't really
Ed's an
approached it.
engineer by training, and I could say I'm more finance, and so we'll probably split the responsibilities that way based on background as well.
Can I ask you, have you researched, because I have seen 2 companies in this space, well funded to the tune of $10 million. Have you researched what else is out there and why they failed? Because it's a big problem, it's a big money maker, people are getting older, home care is, but part of your writing a business plan or idea, have you searched how many people have tried it and why they have failed?
So
with $10 million funding, and what is unique about you guys?
Sure, I can take that. The offerings that we're aware of are Care.com and Sitter City. Our current startups that have received a significant amount of funding that started in the nanny and babysitting space. They've recently gone into senior care. It's more of a babysitting service than actual trained professionals. They are home health aides.
I have seen a company that has all the registered nurses in America under database. Just for nursing, but just for homes. But I haven't seen him around for 3 years after he got funded.
Well, I actually think a lot of those are, what we've also learned about is those registries are state-owned by some of the larger states that provide, so if you're on Medicare and you need a home health care worker, you call your state or look into their registry online. I don't think those are being kept up as well as they should be. I think if costs continue to rise and Medicare gets crushed, those are going to be privatized, and we want to be at the front of that.
Thank you very much, Matt.